So with that, I don't think I need to say anything more, and I don't need to take questions because Anjali is probably going to answer all of the questions. I'm going to welcome Anjali Sadhwani to the stage. Dr. Anjali Sadhwani, she is a neuropsychologist at Boston Children's Hospital, and she's going to update us and talk to you about the natural history study and the value that you have brought by participating in the natural history study. Anjali.
Good afternoon. Can you hear me? I am accurately aware that I stand between you and a coffee break, so I will keep this presentation short but interesting. I'm here to provide an update on the natural history study. It is the culmination of efforts and hard work of a lot of people, spearheaded by Dr. Lynn Bird and Dr. Winhan Tan, and I'm honored to be representing them today. I'm going to be talking to you about all the work that we've done so far and how you as families can help us going forward. So what is a natural history study? It is an observational study. It is longitudinal. You see the same participant on multiple occasions. It's long-term. We see them over many years. It is mostly prospective. We try to understand how your child is doing now, what's their behavior and development now, and how it will move forward as we keep seeing them. And there's some short-term retrospective data, like what age were they diagnosed at? What developmental milestones did they need? It is usually an in-person assessment with the same investigator at each visit. Why is a natural history study important? It is critical for the developmental of therapeutic products. It helps us determine which endpoints and outcome measures can be used in clinical trial. It provides baseline data of the population on these outcome measures. And it helps us understand the clinical efficacy of a drug. It specifically presents us with safety data. Is the seizures when the child is on the drug, is it an observed side effect of the disorder, or is it part of the natural history of the disorder? Okay. How did the AS natural history study evolve? Well, it started off 18 years ago in 2006 under the leadership of Dr. Lynn Bird. We had 6 sites, and families participated by doing annual in-person visits at each site. We collected prospective data, longitudinal data, parent-reported data. It also included EEG, and this study was funded by the NIH. After a brief break, the funding restarted with the FDA, and we launched it under the leadership of Dr. Winhan Tan. Here, we had 10 sites in the study. And what we pivoted is to have it as a hybrid model where you would come in person for a brief assessment, and then we would do things virtually over Zoom, or we would fill out a parent portal. What was specifically unique about the study that was launched in 2017, that we were essentially focusing on capturing data for measures that were used in the current clinical trials and the upcoming clinical trials. Thanks to the support of ABOM, we've been able to continue the study. We now have 9 sites. We have introduced new measures like the CGI, the sleep and seizure diaries, the quality of life measures. We've also trialing a home-based EEG to see whether it gives us the same data as an in-person hospital EEG, which I know a lot of your children hate. This funding has been provided by pharmaceutical companies. Okay. So where are we with the natural history study over the years? We've had over 550 participants through the years, and we've gone over more than 1,600 visits. That is a huge accomplishment. As Allison said, this is the largest natural history study in the world for Angelman syndrome. Okay. So what does the study look right now? We have 9 active sites, 6 of which are in the United States, and 3 of them are in Canada. We know sometimes it's hard for our families to go into these sites physically. So every year, we conduct 2 or 3 off-site visits. Last year, we had off-site visits in Austin, and we also had off-site visits at Fort Lauderdale in conjunction with the FAST conference. This year, we are doing off-site visits. We had an off-site visit in Sandusky, Kalahari, Ohio, and we're doing an upcoming visit in Princeton, New Jersey. What happens at these off-site visits? We have local families come in, we book our hotel room, and we do the assessments there, so the families do not have to travel to the physical locations of the different sites. What's involved in the natural history study? As I said, it involves a clinical in-person assessment where you undergo a physical or neurological exam by a physician. You also do a developmental assessment with a psychologist like myself. You then do virtual visits with either a medical professional where you go over your child's medical history, sleep, behavior, education. You also meet with a clinician to go over your child's adaptive functioning on how they're doing at things at home. We have an online portal where we have families complete both questionnaires about their child, development and behavior, as well about your family. What's the level of stress? What kind of supports do you have? What's your quality of life? This is all meaningful to show the impact of the disorder on your family life. We have collected data on over 64 domains in the natural history study. As you can see, all the research assistants put together all the domains we were collecting, and when I looked at the slide, I'm like, wow, this is a lot of information we are collecting, and it's really, really critical that we get this data out there. We have published 27 papers so far using natural history study data. We have published data on developmental milestones. We published data on developmental trajectories, challenging behaviors, anxiety, burden and stress on the quality of life. Family-friendly reports of our recent publications are actually available on the Ladder to Treatment network. So we have, RTI has collapsed and made family-friendly synopsis of what the data shows and what the results are. Okay. The main goal for the natural history right now is to aid and support the clinical trials that are ongoing. About 60 to 70% of the measures that are used in the upcoming clinical trials are collected in the current version of the natural history study. This is so that we can provide them with data for comparison of how our children look on these measures without intervention so that they can compare it to see how they change in the clinical trial. I'm going to be talking about 3 specific measures today. The first one is the Vineland Adaptive Behavior Scales. It's a parent interview conducted by a skilled clinician. It assesses how a child typically behaves. It assesses adaptive functioning in 10 subdomains: communication, receptive, what your child's understanding; expressive, how is your child communicating, either using vocalization, signs, AC; looks at motor skills, both fine and gross motor skills; looks at socialization, which we know is a strength in our families. How does your child interact with other children? How does your child play? It also looks at daily living skills, adaptive skills, toileting, feeding. So what data have we got so far in the natural history study on the Vineland? The Vineland 3, which was introduced in our study, started in April 2018. So far, 282 participants have completed the Vineland 3, and we have 500 total Vineland 3 data completed. We are now at a point where we have enough data to look at the longitudinal developmental trajectory of how your children change in the Vineland, and to see if there are differences based on whether their molecular subtype or whether they're deletion or non-deletion. The only thing is, if you remember, 60% of our participants have a deletion molecular subtype, as a result of which we do not have enough data to make differences in the non-deletion subtype, and we would really like families to come back and participate for more. The next important scale is the Bailey Scales of Infant and Toddler Development. It is an in-person assessment done by a trained psychologist. It assesses development in 5 domains: cognition, receptive communication, what your child understands; expressive communication, what your child says; fine motor, and gross motor skills. This measure is critical. As you know, this is the primary outcome measure in the current upcoming clinical trials. The current version of the Bailey 3 was only introduced in our study in 2020, and due to a lot of reasons, including COVID, which prevented families from coming back, we've only been able to collect systematic data since 2021. We have seen 189 participants completed a Bailey. If you remember from the previous slide, this is 100 less than the participants who completed the Vineland. In the slide, if you look, only 70 participants have come back for more than one assessment. The Bailey is an important measure for the clinical trials. We are specifically interested to see how your children change on the Bailey over time. So if you have come back and participated in our study and done a Bailey, we'd really like you to come back and do a Bailey with us so we can see how your children participate in change over time, and we contribute that data to the clinical trials. The next measure that we're collecting data on is the ORCA. It's the Observer Reported Communication Ability measure. This measure was specifically funded by FAST and developed by the Duke team to assess communication in our children with AS. We are currently using the natural history study to gather actually baseline data on what are the communication patterns that are seen in your children with Angelman syndrome. And we are specifically interested in looking at how this measure relates to other measures that we're collecting, including the Bailey and the Vineland. Okay. The ORCA, 193 participants have completed the ORCA so far, and 319 participants have completed the ORCA, and the Duke team is currently analyzing this data and working on a manuscript to present this data. So all the data that you'll have been completing has been used, and we're actively working to get this published. Okay. I'm going to just present an example of how our data is used in the clinical trials. So what the clinical trials use is they take age-matched and genotype-matched participants from the natural history study and look at their scores on the Bailey and Vineland, and they use that as a comparator to see the rate of improvement and change in the natural history of this group compared to the data that they see in their clinical trial. The example that I'm presenting is data from the INS HALOS phase 1, phase 2 trial. As you can see, the black line, as Allison accurately explained, is the data from the natural history study and shows change in 6 months. You can clearly see the progress that the participants in the trial with the pink graph are making significantly compared to the natural history data. Okay. We want to ensure that the data we've collected over the last 18 years is easily available to researchers and farmers interested in designing therapeutics for our children. The LADDER database is a data platform that is linking data for individuals with Duke 15 and Angelman syndrome collected from multiple sources such as research studies, registries, caregiver report, and clinic visits. All of the natural history data from the last 18 years is currently created in LADDER. This facilitates data access, linkage, and sharing. There are several benefits of data linkage. It helps us to increase our sample size. We also make sure we have a diverse sample. You can include reports from multiple respondents, clinicians, parents, developmental assessments done in clinic. The goal of this data linkage is to minimize participation burden and duplicate research efforts. And we really want to do this and accelerate knowledge on what is known about Angelman syndrome so far. 34 requests for natural history study data has been done so far. This includes pharma companies, academia, and graduate students. If anyone's interested in gaining access to the NHS data, you can reach out to the website laddertotreatment.org, and you can make a data access request over there. Okay. I want to end by thanking 3 groups of people. The first one is to our wonderful families. We love seeing our families over time. The picture I'm showing you are one of the first few participants in the natural history study when it launched in 2006. It was incredibly heartwarming to see them this past April as adults. We do believe that families find the natural history study useful. It gives them better understanding of what the trajectory looks like. It creates more awareness. It also empowers them to advocate for their children and connect them to other families. At some sites, we also provide recommendations about what therapies are needed so that you can take it back to your school, to your clinics to get more services for your child. If you're interested, please sign up for the natural history study. We actually have a booth outside with all the research assistants standing up there. We are also collecting survey data to see what are the challenges and barriers that are stopping you from participating. We really want to identify the barriers and reduce burden to the families and get as many families as enrolled in the natural history study as possible. Secondly, I want to thank the teams at all the different sites. It truly takes a village. As you can see at all our different 9 sites, there's so many people working together and working really hard to make the natural history successful. I want to do a special shout out to the RTI team who's working really hard to clean our data and analyze our data and publish it so that it can be made available in the public domain. And lastly, a special thanks to our funders. We are incredibly grateful to be able to continue the study for the last 18 years. And we really thank ABOM, FAST, ASF, and the pharma companies for their support. Thank you.